Good day everyone, I am student nurse Shankar Balisa, BSN 2A student from Bicol University, Tabaco campus. So for today's video, I will be demonstrating about the collecting newborn screening blood specimen. Good morning ma'am, I'm Nurse Shane po. Okay, so welcome again po sa here sa clinic. So I can see naman po na consistent naman po yung check-up nyo and ilang araw na lang po is manganak na kayo. So before po ikaw manganak and makita natin si baby, may i-introduce lang po ako sa inyong test. Familiar po ba kayo sa sinasabing newborn screening? Okay, so newborn screening or NBS is test po na gagawin natin sa baby or procedure siya para malaman natin if may mga congenital disorder po yung baby na maaring mag-lead sa mental retardation or pwede rin kasi pong maging cause ng death ng baby. So we have what we call expanded newborn screening po. So pag sinabi natin expanded newborn screening, para siyang program to increase yung screening panel of disorders from 6 to 28 po. So isipin mo yon, it is a very good thing para lang malaman natin if may problem talaga yung baby. Kasi marami po siyang na-identify na problem 6 to 28 po. I know you're wondering, ma'am, why it is important and what is the importance of doing this test. It is to detect if may problem nga po yung baby. Kasi sometimes yung mga baby natin is looks normal po at birth, pero hindi natin malalaman na after a few days or a month may problem pala. So it is important para ma-detect natin before pa magkaroon ng signs and symptoms ang baby. And it is important para magkaroon din tayo ng mga interventions, then ma-prevent yung consequences of these untreated conditions as early as possible. So, if you're wondering din po if kailan natin ito gagawin na procedure sa baby, it is ideally done immediately after 24 hours of birth ni baby po. Okay? Medyo pricey lang po tong examination na to kasi it will cost you po 2,950. So, I will explain to you po yung package na included dun sa 2,950. So, yeah, first po is yung component niya is supplies for essential newborn care such as yung vitamin K, eye ointment, vaccines for hepatitis B and BCG that cost 500 po. Then, another 500 po for the professional fee. Of course, we have to pay them. And yung expanded newborn screening po, yung test itself is 1,750. So, yes, yung last naman po, yung remaining 200 is for the newborn hearing screening test. So, overall po, 2,950. Yes, it is costly po, but we are talking about life here. So, ano naman po ba yung money na yon? Para lang, it is to save the baby po, di ba? But don't worry po, because yes, it is costly po, but since under po kayo and covered po ng PhilHealth yung panganak nyo or yung delivery nyo, is marireimburse din po yung money na gagastusin nyo, okay? So, I think it will take a month or a week lang po. And after that, you will get the money po. So, it is a good thing na covered po kayo ng PhilHealth, okay? So, since pinili nyo po, ma'am, or pipiliin yung dito mag-deliver ng baby sa clinic, you can avail po yung ENSB po, or yung expanded newborn screening, and yung blood samples po will be collected by us. Pwede naman po siyang i-perform sa hospital, lying-in, private clinics, and it will be collected po as well as ng mga physician, nurse, medtech, and yung mga trained midwife po. Trained midwife kasi this is a procedure na very medyo delicate din. So, kailangan po talaga hands-on and marunong po talaga yung magagawa po nito. So, I'll explain to you po the possible outcome or result of this exam or test. So, it's either positive or negative. When we say positive po, the baby has, yung positive po siya sa mga mental retardations na included doon sa 6 to 28. Then, also, when the baby is positive or has a positive result, he or she must be referred po sa specialist for the confirmatory testing and further management po, di ba po? So, for us to have early interventions to avoid and to manage the possible disease. So, it's been 24 hours po since your delivery and si baby po is okay na po. But, since napag-usapan natin yung about ENSB po, I have here yung ENSB card po. Then, I have to fill out this with your informations po. But, before that po, I just want to make sure po na yung information that you are going to tell to me is exact po, right? Kasi po, this is very crucial po. Kasi, for example po, yung baby nyo has a positive result, yung newborn screening center will call you or us. Diba po? So that they will inform us about the situation or the result of the baby po. And, it's either po, they will call you or they will call us. We are not going to wait for the courier para ibalik sa atin to kasi it will take days pa po. Okay? So, let's start with your basic information po, yung baby's last name, mother's first name, date of birth, time, sex, weight ng baby, date of collection, as well as the time, yung age of gestation, yung specimen, of course, the heel, yung feeding po, then yung place po, here sa clinic, okay, place of birth, the practitioner, and also the practitioner's day, contact number, baby status, okay, your guardian's name, yung address nyo po, yung street, yung number, barangay, and that's all po. So, good morning po. So, now I am going to perform the newborn screening test to your baby, but before that, I have to ensure first the expiration date of the newborn screening card has not passed, okay? Then, we already done filling out the information here sa demographic data portion of the card, and I hope na tama naman po yung mga information na you said sa akin a while ago. So, okay, I have to avoid touching the air with the circles po kasi sometimes the skin oil prevents saturation po, and also yung filter paper section po might be contaminated po, that will masira po yung result or for the examination. Okay? So before we start po, I have to ensure yung identity ni baby. So, okay, she's baby obsequio. Then after that, I have to warm the heel for 3 to 5 minutes po to increase the blood flow supplies of the area. So, I will be using warm cloth. Okay, we're already done. So, for the site selection po, the recommended site for sampling is in the plantar surface, laterally beyond an imaginary line. So, let's just assume that we have here the imaginary line, okay? So, we are going to prick on the puncture side or the lateral part of the heel of the baby. So, after the selection of the puncture side, the area is cleansed with the cotton. So, I have here a cotton with alcohol, and I will clean it with it using this. Then, let's allow it to air dry for approximately 30 seconds. To prevent po yung mixture of blood and an antiseptic solution. Okay? So, I have here a lancet. So, I will use this to prick the heel of the baby. So, the base of the automated lancet is then placed flat against the heel, so which is punctured using a quick controlled stroke. So, if this is not available, other clinic or hospital use syringe po, yung needle ng syringe, but medyo mahirap yung gamitin. So, also if not available, kung ano ang gagamitin nyo is pricking must be controlled, okay? Okay, this one. Then we are going to prick. After pricking, the first blood is wiped off with cotton. Kasi sometimes it may contain yung cell, alcohol, or excess tissue fluid which may distort the test results. So we are done pricking the baby's heel. So after that, we are going to hold in a dependent position and apply gentle pressure to facilitate blood flow. We should avoid yung excessive squeezing kasi of the heel kasi it might cause hemolysis or contamination of the specimen. So yes, after that is we have to make sure na sakto lang yung blotch ng blood sa bilog kasi sometimes ma-reject ng machine kapag di sakto sa bilog, okay? So we have here our NBS specimen collection paper. So first, before blotching po, is we have to accumulate the blood before blotching on the filter card so that po may enough blood before we blotch. And also, after that, we are going to touch the first circle of the new screening card gently against the large blood drop. We have to avoid layering kasi the machine might not accept it. Okay? So after collecting the blood samples, we have to cleanse the heel of any residual blood. We're going to apply gentle pressure with a cotton ball, and it's applied until the bleeding stops. Already done doing the procedure. So here it is. So I made sure that there is no layering of the blood kasi layer of blood drops to the same circles may interfere the accuracy of the test. So yes, we are done. And also, kapag may layering or may mga problems in dropping the blood or the machine may not accept it or reject yung procedure or the filter card, okay? We have to let this dry for at least minimum of 3 hours. We have to keep them or avoid from the direct sunlight and away from the other heat source. After the blood spot dried completely, we have to send it on the newborn screening center for the procedure and examination.